Hi, I'm Dr. Rob Silverman, host of Proven Health Alternatives. Great episode. Dr. Ryan Cedermark. He has excited me, a young chiropractor, functional neurologist, functional medicine practitioner, nurse practitioner, sharing how you can look at the body from the inside out and get great clinical outcome on the gut to brain axis. This episode is a must see. Hey everybody, Dr. Rob Silverman here. Proven Health Alternatives. Dr. Ryan Cedermark, a superstar chiropractor, functional neurologist, nurse practitioner, functional medicine extraordinaire. Thanks for taking time and coming on and talking with me.
Thanks for having me, man. This is awesome. I've watched, before we spoke, I've watched tons of your videos. I've never been to a live course, but I was secretly stalking you on the interwebs, and I've learned a lot from you. So I really appreciate everything that you're doing for our field, because you're you're full of knowledge, man.
I appreciate that. I guess you're the one person watching. I thank you for that. I appreciate that. But believe me, it's great to hear people like wanting to learn and wanting to share. And I know you're really busy. You know, you work 7 days a week. I feel your pain, but there is really no pain in working 7 days a week. You're on a mission. So why don't you tell everybody, like, instead of having me read your very impressive bio, I have it right here. Why don't you tell everybody what you are? You're a chiro, nurse practitioner, functional medicine, functional neurologist. Just, you're a chiropractor. Where'd you go to school?
Yeah, chiropractor. I went to school at Life University here in Atlanta, Georgia, and I was going through the program, and I loved the program. Everything was resonating with me, just the way that we talked about health and lifestyle and medicine, right? Chiropractic healthcare. But I just had so many questions that I felt like weren't getting answered. So I kept asking and asking. And at one point I had one of my professors just get fed up with me, and he's like, just ask God. Like, I don't know how to answer your questions. Because I had so many questions. I was coming in fresh. I'm not from a chiropractic family. And I just wanted to know how things worked. And it was tough because, you know, I would see these amazing changes in patients with a simple adjustment. And I just wanted to know more. So I dove in while I was in the program. We were fortunate enough at the time that Dr. Carrick was teaching his chiropractic neurology courses on campus. I was sitting on the fence about doing it because it was either like go hang out with my buddies on the weekends or learn some neurology. So one of the professors there, Dr. Jim Duffy, he's great. He practices here in Atlanta. He was like, you got to do it. So I did it. I got hooked my first class. And one of my teachers, Brandon Brock, he was also a nurse practitioner. So, of course, you know, going through chiropractic, you kind of hear some of the bad stories about modern medicine. And he was telling me all the interesting things that he was learning. So I put it on the back burner, but I told myself, I'll go through the chiropractic neurology, I'll finish chiropractic school. And if I love it and I'm still not interested in nurse practitioner stuff, I'll just keep doing chiropractic. But after I graduated, I just kept wanting to know more and more. And so I continued to practice part-time. And I moved back in with my parents, who I called my roommates because, you know, I was like this young doctor feeling all cool and smart. But then I had to move back in with my parents so I could afford to go to nursing school. But I went to nursing school, did that, had to backtrack a little bit so I could take some of the I guess, required courses for nursing that wouldn't cross over. And then I finally got my nurse practitioner degree as like a family nurse practitioner. So that's kind of my educational journey in the convoluted way to my idea of the top of the mountain for me educationally.
Well, that's a unique trifecta when you think about it. Chiropractor, functional neurology, functional medicine, and nurse practitioner. So for those who are watching who don't know, Dr. Carrick is the father of functional neurology, genius, fantastic. You want to give a little, I think they know functional medicine. They watch the channel. They know we do functional medicine. We look at systems, not symptoms, root cause resolution. What's functional neurology? That's a newer term for some of the listeners.
Yeah, so functional neurology, the way I describe it to patients is I describe that you're not necessarily looking for systems that are broken in the neurological system, but you're just looking for some inconsistencies and insufficiencies. So, you know, it's almost like you're looking at the neurological exam from a different lens. You have on a different pair of glasses, and you're just looking to see, hey, okay, they can do this activity, but how smooth is the activity? How naturally can they do it without having to think about it? So in a sense, functional neurology is just looking at the nervous system in a different lens, and find the inconsistencies and insufficiencies within that system, and then how to rehab it to make it better.
if I'm interested in getting more information on functional neurology, what would you suggest? Book, courses, the whole gamut.
Man, that's a tough. There's so many. So there's a lot of information out there now on functional neurology. Obviously, you can check out the Carrick Institute. That's where I started, and I really got heavy into functional neurology. But then I branched out because as I learned more functional medicine through guys like Dr. Datis Kharrazian, he began to integrate more of the nutritional component to the functional neurology component. And he created, with Dr. Brandon Brock, a 150-hour course called Functional Neurology Seminars. So I would also Google that. But then the most basic, easiest book, if you're a practitioner or you're a parent or you're a patient, is Dr. Robert Melillo's Disconnected Kids book. He works with a lot of children with neurodevelopmental disorders, but he describes functional neurology very nicely in a small, readable book.
Outstanding. Well, Datis Kharrazian, we all know he's without a question a leader in our field, PhD, Harvard. Hope to get him on the show. He does a great job. Got a lot of respect for him. So you learn from the best. That's good to hear.
Yeah, they got annoyed with me. I had to bug them a lot because I still had questions, but all those guys, just like yourself, you guys are paving the way for a healthier future. So I'm just grateful to be able to learn it.
You're being way too kind, way too kind. So within your functional neurology, functional medicine mix, like what's the kind of patient are you looking for? What do you want to share with everybody so they know and they have that aha moment? I need a Ryan Cedermark.
So my favorite patients are the ones who are doing everything right, but they're just not getting better. So for example, the way when I learned functional medicine, you're working on cleaning up their diet, one of the most important things, looking at environmental stressors. And so you're making sure that they're putting all the right fuel in their system, but for some reason their system isn't appreciating the fuel, the nutrition that you're putting in, the supplements that they're putting in. So my favorite patient is the one who they're still not getting better despite doing all the right things. And that's where I think functional neurology plays an important key role in how the brain is communicating with the rest of the body and how the brain's appreciating the nutrition and all that other good stuff.
So you're mixing them to connect the dots. So it's kind of like a lack of communication and doing all the right things, but they haven't flow charted or communicated because the body's all about communication, right? And that's where you take it to the next level, if you will.
Yeah, hopefully. I mean, that's always the goal because then, of course, you get the patients and then you look at them and you're like, crap, they are doing everything right. I can't find anything on my exam. I don't know where to go from here. But a lot of times, from what I learned in functional neurology, you can see areas of the brain that are responsible for communicating with gut or other parts of the body that just aren't working the right way. And when we get those areas of the brain and body back in line, it can actually appreciate the nutrition.
Great. So what I'll do is we'll talk a little functional medicine neurology there. I've never done this before with anybody. So I'm going to say a word and you tell me thumbs up or thumbs down. How does that sound? And say, because we're on a podcast too.
Okay.
Gluten.
Well, say that again.
Gluten.
Thumbs down.
Thumbs down. Big
toe down.
So it's fair to say that gluten's not only bad for your gut, but it's bad for your brain, right?
Super bad for brain.
Super bad. So no gluten. Dairy.
Thumbs down.
Thumbs down. Corn.
Thumbs down. Despite so I've kind of been like this with corn. There's a lot of I believe there's a lot of research now showing that you really have to be careful with the pesticides and glyphosate, despite people not being reactive to corn, being reactive to things that are around the corn. So obviously, I think it's a better choice than doing a flour tortilla or tortilla if you're eating tacos. But I don't know what your thoughts on that one is. But
I'm with you, man. So far, so good. But how about rice?
Gosh, man, rice is tough. I have to give it a thumbs down. If you're really looking at cleaning up the brain and the body, I would give it a thumbs down. But I would also say maybe it's okay to eat occasionally.
All right, so we got a couple of thumbs down. Why don't we give some people, before they decide to jump off the Verrazano Bridge, some things they could eat to have a good, healthy brain?
Only celery.
Celery juice, you meant, right?
Only celery juice, yes.
Right.
No. Obviously, my wife. She's pretty amazing. She cooks tons of gluten-free, dairy-free meals for myself, her, and my son. But anything that you can eat that's a little bit more natural. The simplest thing to remember is when you go to the grocery store, just shop on the outside. Don't get sucked onto the inside because that's where all the bad stuff is. But I always say lean meats, proteins. If you've done food sensitivity testing, always kind of follow along with your functional medicine provider. But healthy, good lean meats, veggies, and proteins. That's usually the best thing for you. And then doing some intermittent fasting with that.
Ah,
Um,
yeah.
Great for brain.
Great for the brain. I love it. Great for the gut, great for the brain, which we definitely have to cover. Now, you told me you're a nurse practitioner.
Yes.
So first, if you would tell everybody what a nurse practitioner is, some people may not know, and then tell them how you mix that in your world.
So nurse practitioner, you're a primary care provider, but you're kind of like an intermediary primary care provider. So sometimes now you'll go to the doctor, and unfortunately, this is most of the time for insurance issues. You'll see the nurse practitioner instead of the doctor because we're a little bit more easily disposed. But we do have really good training. Everyone that is a nurse practitioner has to have their Bachelor of Science in Nursing, and then you have to take advanced classes to get your primary care certification. But yeah, you're a primary care provider. It's all state dependent. So in Georgia, I have to have an overseeing medical doctor that we review cases with, and he signs off on charts with. Some areas you're just a primary care doc, so you can go and see a nurse practitioner. I was fortunate enough to do my rotations with a medical doctor who's certified through IFM. So I learned primary care a little bit differently than the average nurse practitioner.
Now, are you allowed to administer medication, script for medication if needed be?
Yes. Yep. Yeah, we can prescribe and then also unprescribe, which was my main goal in getting into that for some of the chronic patients.
So if I come to you and I'm on a statin, I'll use that. You're able to take me off the statin and give me a more eclectic approach, if you will?
100%.
That's good to know because so many patients want to get off the drugs or get those drugs evaluated because they want alternatives like a functional medicine, functional neurological, functional nutrition perspective. So they should seek out somebody like you or somebody who's trained in functional medicine and nurse practitioner so they can make the needed changes that they may want and what they may need.
Yeah. And also, just there's a lot of, I've met I've always thought medical doctors are bad, but sometimes they just don't know. There's a lot of medical doctors actually really getting involved with functional medicine. So if you don't like your doctor, I would switch because if they're just throwing pills at you, you're seeing the wrong person. They're not appreciating the whole system. I don't know if that's fair to say.
I think it's fair to say it's your opinion, and I think that it's what we're seeing, and it's really this change, the left and the right per se. The medical doctors have to stay so medical, and those who don't want to are now coming to another side in this power because no drugs make no sense. Drugs used appropriately for certain patients make a lot of sense. I always tell everybody, they ask me, you're a chiropractor, would you take a drug? And I said, if you threw me in a pond and I got meningitis, bring it on.
Yeah.
Bring it on, of course.
That's my same philosophy.
Right. Bring it on. They're very powerful. Would I ever get an epidural? Of course. Is it the first thing I would do because I have a little backache? Probably not.
Yeah. I 100% agree with you. It's crazy. You see patients and young patients and they have these episodes and all of a sudden they're on a medication. And the one question I always ask a patient is what's the doctor's exit strategy? What's the game plan for getting you off? And 99% of the time, they never talk about that. It's just here's your medication that you presumably have to take for the rest of your life. Even though, the majority of chronic diseases are reversed through diet, exercise, and healthy lifestyle. So.
Chronic disease.
Yeah.
We should define that. Chronic disease is disease that someone has for 3 months or longer that can't be cured by a vaccine or aided by medication. It's 86% of our dollars spent on that in Medicare, chronic disease. So you and I could stay here for hours on chronic disease. I have a funny feeling that you are a gut to brain axis guy.
Yes. That's my new favorite topic.
New favorite topic. It's one of my favorite topics.
Are you writing a book on it?
I am writing a book. It's called, thank you, shameless plug. Here it comes. Superhighway to Health, February of 2020. And within that concept of the gut to brain axis, autism, because I know a lot of functional neurology gentlemen work with that. You want to give us your take on that?
I haven't done tons of research on this, but what I really started reading about, especially with neurodevelopmental disorders and autism, is it all starts before they're born. You know, maternal health is extremely important. Route of delivery is extremely important for good gut-brain access, vagal tone, but then the fetal stress. So stress of mom during pregnancy and then after the baby's born, there's research that actually shows that there's a lack of vagal tone in, and of course this was done in mice and rats, but that there's lack of vagal tone in these rats who experience like childhood stress and trauma. So they lost the connection between brain gut so early on that that pathway became negatively plasticized. And so they developed all these different types of gut issues and food sensitivities, along with neurological disorders such like autism and ADHD. And then there's also research really that's showing, you know, using good nutrition and good probiotic therapy and completely changing the way that these children are eating can have a profound positive impact on the brain. So with autism and gut brain, I think you can't talk about autism without addressing the gut brain axis.
I concur. I mean, there's so much robust literature right now on the gut and the brain for the mom, for the child. I mean, I just read an article that said that 90% of children, and we can cite it if anybody asks, that have autism have a gut problem.
Oh, yeah.
So, you know, the gut to brain axis, we could be here all day. And you talked about the vagus nerve, VAGUS, vagal tone. So right about all that. That is a plethora of things to mention in there. So since I posed the question, why don't you discuss the importance of the gut to brain axis in health?
Okay, well, can I tell you my love story and how I fell in love with the gut brain axis?
Everybody loves a love story. Go ahead.
So I got a message from a nutritionist in California. Her name's Jessica Flanagan. She's really smart with autoimmune paleo diet, and she messaged me and she said, "Hey, I got this, I guess a phone call from a young girl that read my book, and she sounds like she might be more of a neurology patient than a nutrition patient." And long story short, what happened was she referred a patient over to me who'd suffered several concussions. So she had severe TBI and she was having all these gut issues, but she was seeing a functional medicine provider and she was doing all the right things nutritionally. But unfortunately, what the game plan was moving forward, this is a 27-year-old girl, the game plan for her moving forward, despite seeing functional medicine, gastroenterologist, all these practitioners, was she was having to take basically a liquid supplement, from a really good liquid supplement that's like, it's just completely broken down into amino acids, and she was having to drink this every day just to get her nutrition in because she couldn't eat. She physically couldn't do the job of chewing and swallowing. She would just throw up. So she hadn't been able to eat a full meal in almost a year by the time I had seen her. So I did my whole evaluation on her. And again, this was a patient who she's doing all the right things nutritionally. She's lifestyle wise, she's reduced stress in her life. She's doing some really great natural things, but her history of concussions was what really rung a bell with me. So I started doing research on the brain gut axis. So trauma to brain and how it causes issues in the gut. And what I found in the literature was there was this team in 2009 who showed that traumatic brain injury in rats, actually 6 hours after, it could actually screw up their intestinal microbiome, and it can cause leaky gut. So then they actually did a follow-up study 2 years later that showed vagal nerve tone, so activating the vagus nerve, but then trying to create traumatic brain injury had no effect on the gut. So essentially it was showing that increased vagal tone could help heal gut brain. So I started doing my whole neuro exam, and I found areas of the brain that just weren't working good that are responsible for helping with digestion. And I found that she had a bad vagus nerve. It just wasn't working the way that it should. And what we did was we did a ton of therapies on her. And obviously our goal was to try to get her to eat again. And the way we were doing treatments back then was she'd come in a couple times a day and we would do therapies with her, because with functional neurology, the goal is always repetition and activation. And by the fourth day of our treatment, we started reintroducing foods, and now she's eating full meals again. So to me, I think one of the biggest things that I've seen clinically is that if the vagus nerve isn't healthy and it's not working good, your gut's not working good. If the vagus nerve isn't working good, there's probably a brain issue that may be underlying that we haven't seen yet. And there's got to be some sort of way to try to rehab that area nutritionally, and then through some sort of neurological exercise.
That's outstanding. Vagus nerve, brainstem down to the intestines, medulla oblongata down through the transverse colon. Absolutely one of the key components of the connector. You are spot on. Everybody listen to him, because that is without question a critical element. And by the way, that vagus nerve is number one property. Everybody thinks it's just to talk about the gut to brain axis. It's actually to decrease peripheral inflammation. So outstanding. Those are some real takeaways that everybody can take on Monday morning, if you will, and start putting it in. So now you mentioned it, like, well, where do we go? Who does this kind of work?
Yeah, so this gets a little bit more functional, but Datis Kharrazian, he wrote a book called Why Isn't My Brain Working? And he has a whole chapter on the brain gut brain axis, and he talks about some exercises that you can do to try to test the integrity of the vagus nerve centers in your brainstem and see if they're actually working and communicating with your gut. So if you have the biggest thing is, if you're a patient or a practitioner or anyone, if you have gut issues like constipation, or if you have any type of gut issue, do some tests to see if your vagus nerve is working. And one of the easiest ways to do it is to check your gag reflex. So I don't necessarily recommend you doing it on yourself, but you can have your gag reflex assessed. And if you don't have a strong gag reflex, you may not have a good vagus nerve, because the muscles that activate the gag reflex are from the vagus nerve. So you can check that. You can try gargling water. If you have difficulty swallowing pills, your vagus nerve probably isn't awesome. So if you're taking a lot of supplements, but it's hard to swallow pills, you may need to exercise your vagus nerve. Other ways to exercise your vagus nerve simply is just by getting exercise. Going out and walking has been shown to actually help increase the microbiome diversity, which will help reduce peripheral inflammation, get the vagus nerve better, stuff like that. My favorite one, though, is jumping on a mini trampoline. And I would use that with patients, because when you distend, all the muscles inside your guts, they're muscles. So when you distend and then you increase the signaling pathways from brain to gut by getting motion, that's why running and walking works, you're actually increasing vagal tone by doing that. So it's very simple therapies. There's websites out there where you can look up and it says like how to stimulate your vagus nerve, yoga, meditation. There's so many ways, but knowing that your vagus nerve might need a little bit of attention is probably the best thing, because then hey, I'm taking the right supplements, but I'm not getting better. Maybe I need to exercise my vagus nerve.
Outstanding.
And I'm sure you're going to talk about that in your book too. So
I think so. I'm excited. Thank you. I just realized I think I'm going to give you my book, and I'm going to let you intro it for everybody. You're doing a great job. But it's really good information. People need to know this. And for so long, we've been just, the medical fields and even chiropractic, too much symptoms, not enough systems, not connecting the dots. Everybody waiting till something goes wrong. Everybody's become so reactive as opposed to proactive. I mean, I just looked at a chart and it spoke about we've doubled or to tripled our pill intake in the last 10 years, yet we're the unhealthiest out of these 11 countries and everything like that. So, we've got to look at this more holistic model. Otherwise, America's not going to get healthy. There's no health insurance that's going to help them with that.
100%. I 100% agree. Actually, you touched on that. I saw a patient this weekend. She had a traction injury to her arm. So she was walking her dog and the dog pulled her arm out of socket. For the past year, she's had chronic pain in her shoulders and in her arm. And she's done everything, like you said, addressing symptoms, chiropractic, she's done physical therapy, but her pain was so bad. I looked at her medical history. She has a history of Crohn's and post-concussion syndrome, and she's never done anything to help heal her gut. So I told her before we even try something, you've got to help the gut, you've got to help the brain, so you can dampen that peripheral inflammation, get you out of pain. Because she's taking so many pills. I'm like, it's just, there's no point. So yeah, cool stuff.
What's the most pills you've seen a patient take?
Oh man, I think so. I was working when I first graduated. I was working in a really rural town in North Carolina. It was just a shopping bag. It was like 20 pills, I think. It was bad. There was like 2 multivitamins in there, to give him credit, but it was lots of medication.
Wow.
It was almost close to like, it was probably like 15.
We are without question over medicated. So give me some of the things that people can do to have a better brain or better brain health.
So I think the most important thing for your brain is to keep stress away. And a little bit of stress is good, and there's obviously different types of stress. Some physical stress and exercise is good. But if you have emotional stress in your life, if you're in a stressful environment, your brain can't heal. It's always going to be working overtime, and the brain just doesn't work well long-term in stress. So whatever you can do to reduce stress in your life, your brain and your body are going to work better. You can feed yourself all the supplements you want, but if you continue to put yourself in bad stressful situations, you'll never get better. So I always recommend whatever you can do to reduce stress, either by removing yourself from certain situations or relationships, or engaging in activities that can increase your resilience to stress, such like meditation or yoga. And then I'm a huge physical exercise person. My wife, like, my brain doesn't work unless I get exercise. And I'm also kind of cranky, so I always get kicked out of the house to go do my runs. So I'm a huge fan of doing some sort of weight resistance and some sort of running, whatever works best for you. It doesn't have to be Arnold Schwarzenegger type stuff, but as long as you're getting some physical activity, getting outside in nature, I think is one of the most important things. There's just so many, but you gotta reduce stress. That's the biggest thing, and you gotta eat right. You can't out exercise, or you can't beat an unhealthy diet, no matter what you do. So, and you got to feed your brain the good stuff. This puppy's a Lamborghini, so if you're giving it the bad gas, it's not going to go far.
I wish people would understand that food is information, and food's your ability to gas your organs. The most important one, obviously, is your brain, because it communicates with everything else. How can people get in touch with you? Social media? What are you up to?
So yeah, I work here in Atlanta, Georgia, and I see patients like functional medicine, post-concussion patients on the weekends. But I also have a Facebook page called Brain Chat, where I'm gonna steal your time and interview you, if that's okay one day. But we interview people like Dr. Silverman, just to talk about brain health, what they're doing for brain health. And the page on Facebook is called Brain Chat. And then we teach little monthly webinars, and we try to keep them condition specific with a functional neurology and functional medicine approach with Dr. Brandon Brock and myself, and my other friend, Dr. Kyle Daigle. So thebrainchat.com is our website. You can check it out, and make sure to follow us on Facebook and Instagram on Brain Chat, because I just put out a daily post on there.
So if they want to listen to the webinar, if I want to listen on the webinar, I just have to go to Brain Chat and I can get to the webinar.
Yeah, all of our videos are on our Facebook page. We've interviewed people like Dr. Stephen Porges, who created the polyvagal theory. Dr. Karazian's been on there. We're going to get you on there. So it's fun.
I'm coming.
Yeah, and we have a YouTube channel too, so they all get uploaded to YouTube.
That's fantastic. Well, this has been great. We have to, without question, do it again. You know, you're a breath of fresh air for me. Believe me, you're exciting me. I'm ready to see my patients in the afternoon now. So you take care of yourself, Dr. Ryan Cedarmark.
Yes, sir. Thank you so much, Dr. Silverman.
You're the best. I appreciate all your time. Dr. Rob, always yours in health.